Now, as a parent, how are you going to assure me my child's not going to wake up during the procedure and be in pain? Is that a common question, by the way?
It is a common question. In fact, there's a movie that's going to come out shortly about recall. It's a real phenomenon. It's very unusual. But let me go back just for a second and kind of look at the continuum. Sometimes people remember hearing things. And they'll say this, but if you actually listen to their story, they were having a colonoscopy and they heard some things during that procedure. That was not general anesthesia. As you move along the continuum and people are deeply asleep, they don't respond to anything, including surgical stimulation. Through the monitoring that's available, you can tell when a person starts to feel something because their heart rate and their blood pressure may increase, and you adjust the anesthetic based on some of those physiologic changes. So once the anesthetic is started, it's all titrated to effect. There is no specific dose for every patient. It's all individualized.
It's a custom report. What are the side effects of this anesthesia?
Common side effects, you may have a sore throat, scratchy throat, you may be nauseated. There are common things and there are very uncommon things. And we're prepared for all sorts of emergencies, and we will deal with those as they arise. But common things, sore throat, nausea, maybe a little unsteady afterwards for a period of time until they...
Probably the most common thing for parents to experience when their children wake up from anesthesia, and can be a little unsettling, especially if it's their first experience with their child waking up from anesthesia, is what's called a postoperative delirium, or it's a state of agitation that is actually fairly common when children wake up in the first hour after an anesthetic. It can be characterized by something as mild as them just not feeling right, up into the point where they're very angry, agitated, crying, even screaming sometimes when they're waking up. Now the children usually don't remember this part, but it can be very unsettling to the parents to see their child very agitated.
Is this something you tell the parents prior?
We all the time. I do that every day.
It's why we have the parents come into the recovery room, is to help us, because sometimes it's pain, sometimes a different environment, sometimes they may be hungry, sometimes just an emergence agitation from the anesthetic agents. And there are factors associated with it, like having surgery on your head, like having tubes placed in your ears or tonsils removed. That's a common factor associated with it. Certain age groups are associated with it. Certain anesthetic agents are associated with more emergence agitation than others. So we do teach the parents about all of that, and they help us in the recovery room.
And that's not to scare anyone. That's just a very common reaction when children emerge from a general anesthetic.
Yeah, I
always tell parents, we love to have the parents in the recovery room because it helps us settle their child, and it helps settle the parents who we've taken their child away and take them into a black box, and then they emerge and all they want to do is see their child, and you could come out and talk to them afterwards, a surgeon can talk to them afterwards and tell them everything's fine, but until they see their child, they're still unnerved.
Well, of course. Now, when do you release that case? When do you say, okay, this is over, this patient's going to be fine? Immediately after surgery, or do you follow up after recovery?
It's an open question. We do follow the patients. But if a patient is going to go home from a facility after an outpatient procedure, we would call them the next day to see how they were doing. If a patient's admitted to the hospital, somebody sees the patient in the hospital to make sure that the anesthetic has gone well and that there haven't been any unexpected complications. But to answer your question more specifically, the first phase of recovery usually takes about an hour or so. And then patients, when they have gotten to the point where they're back to their preoperative state, they're drinking fluids, they're comfortable, their hemodynamic and respiratory parameters are stable, then we would let them go to the floor or to the next phase of recovery if they're going to go home.
So as Dr. Holloway pointed out, our job just in taking care of these patients, while it doesn't start when they enter the OR, it doesn't end when they leave the OR. So we're involved preoperatively in making sure that they're safe and in their best optimal condition for a surgery. And our job doesn't end when they leave the OR. We watch them in recovery room, provide additional pain medications, anti-nausea medications if necessary, and also follow up with them a day or so later when they're either on the floor or if they're admitted to the hospital, or through a telephone call from someone from our department if they've gone home the day of surgery.
I think, Joey, this is all true for common surgeries and, tonsillectomy, hernia repair in children. But we're a major tertiary care center at Carolinas Medical Center, and we also do complicated surgeries,
Like open heart surgery.
open heart surgery for children. Obviously, they're going to end up going to the intensive care unit afterwards and be on a ventilator or breathing machine for a day or several days, and we tell the parents that. So there are surgeries that children are not awakened at the end, but the parents are always told that ahead of time.
Right.